Welcome to the Assisted Conception segment on the Health Monitor Show. I'm your faithful host, Joan Mbanefo Ologe. And the last time we were together on this show, we spoke about what criminal abortion is and the legalities surrounding abortion and criminal abortion. We also spoke about the difference between spontaneous abortion, which is called legal abortion, and criminal abortion. So we're back again today on another insightful episode of criminal abortion. Now, we all know that abortion has its risks due to the sensitive nature of the procedure. But like we've always said on this show, it is better when a licensed physician is the person in charge of the procedure. On this new episode of Criminal Abortion, we're going to be looking at the categories of women that are at risk of abortions. And not just that, we're also going to look into the consequences of criminal abortions. I am not the only one that's going to be speaking on this. Dr. Shola Akinniyi, a gynaecologist, consultant, and fertility expert at the TruCare Fertility Clinic, will be giving us medical insights on the different women that are susceptible to the risk of abortion and also the consequences surrounding criminal abortions.
Where there are the likelihoods of infections, abortion is also very risky. Abortion is also risky if the woman has has procured abortion previously, or multiple attempts at abortion, or even in the index abortion. If, for example, the woman has seen a quack in the neighborhood or in the society. They have tampered with the pregnancy. He has taken drugs to tamper with the pregnancy, took some concussions and all that, then ends up even at the doctor's table, for abortion or post-abortal issues. Such cases may likely progress to severe complications. And then what are the factors that actually make abortion less risky? Now, abortion will be less risky if we remove all those risks that I just mentioned. If it is performed by a legal person, which is a healthcare provider, a physician, trained personnel, and if the right method and right expertise are available, the right environment that is free of infection, entails, and of course the right tools. When we get to the methods now, we'll examine the tools used for abortion.
A lot of abortions in Nigeria are carried out in secret. Why? Because of the strict laws surrounding abortions. Now, because of that, unsterile and dangerous methods are being used by illegal abortionists who carry out these criminal abortions on women, young or old. Self-traumas, oral, and surgical methods are these methods that are used to carry out criminal abortions. These methods are dark methods being used, and these women stand the risk of permanent damage to the womb, or even worse, death. With every action comes a reaction. This is the natural order of the universe. Have you ever heard or wondered in details what actually happens during the process or after the process of carrying out these criminal abortions? A lot of people are not aware, and they don't understand the grave consequences that comes with carrying out criminal abortions without the supervision of a licensed physician. A lot of the times, these consequences are irreversible. Some women may bleed out, some have their bladders perforated using surgical methods, and even worse, some even die. Dr. Shola Akinniyi highlights a case study where he interacted with a young lady who decided to carry out criminal abortion, which was extremely sad, to say the least. Dr. Shola Akinniyi gets extremely real with us, discussing the different consequences that comes using these methods to perform criminal abortions by illegal abortionists.
All this right make complications less liable, and if they occur, they are more likely to be less in severity. Now, for spontaneous abortion or legally induced abortion, doctors use, there are about 3 methods, that is medical method, surgical methods, and combined methods. But the difference here is as these are prescribed and they are approved and tested methods that would lead to less complications and in terms of frequency and severity. On the other hand, because in criminal abortion, the act of abortion itself is performed in secrecy because people don't want to come out into the public. The woman is afraid to approach doctors in a hospital environment, so he goes to a quack down on the streets and all that, and it's all manner of methods. Now, what are these methods that criminal abortionists use? First, there are also 3 methods. People first try, the woman may first try, or let me say the woman that wants an abortion or wants to abort a pregnancy, many of them first try to inflict self-trauma. That is, they can deliver blows into the lower tummy in an attempt to cause an abortion. People deliver blow to the lower tummy, blunt trauma to the lower pregnancy. This is an attempt to harm the baby, to cause bleeding. And the belief is that when bleeding starts, it is likely to flush out the pregnancy that is ongoing too. Invariably, this leads to complications down the line. Now, people also take all kinds of drugs, and drugs can be taken orally. It can be some that is orally by mouth, or inserted. Some are inserted into the and some are taken as injections. People take all manner of things by mouth, tablets, concoctions. What I mean by concoctions are things mixed together, a little soap here, a little powder there, a little plant extract or leaves and all that, grinded together, and then they take it in an attempt to poison the pregnancy. And some go to the extent of drinking or imbibing a lot of high alcohol spirits like rum and all manner of spirits. Now, these are done in order to poison the pregnancy. We'll get to the consequence later. Some use douches, pessaries, and insert concoctions into the vagina in an attempt so that it can pass through the cervix or the mouth of the womb into the womb itself and affect the ongoing pregnancy. Now, all these have consequences. The third reason is, but remember that what is common with all this is they are done in high doses. High doses, in other words, there's no measure. They just take it as their whims would allow to poison the mother, the pregnancy. But we should remember that before whatever you take gets to the baby, it must first get to the mother. It's in the mother system. So whereas the teenager or the adolescent or the woman that wants to procure abortion thinks that by taking such and such a drug, she's going to harm the baby. But before they harm the baby, they must first harm themselves. So what I mean is that in order to poison the pregnancy, they also poison themselves.
From everything that Dr. Shola Akinniyi described and said, you can't help but wonder how many women actually go through these things. You can imagine a young lady allowing an illegal abortionist carry out the criminal abortion procedure. Let's look at the case study of the young lady that he encountered that allowed an illegal abortionist perform criminal abortion. At the end of the day, her intestines were coming out. This procedure is very high risk and it's extremely scary. You can imagine the number of girls living with infections today because the abortion wasn't properly carried out by a licensed physician, or having their bladder perforated, then resulting to urinary problems. Please, we hope that a lot of young girls and women out there listen to the consequences of carrying out criminal abortions and allowing an illegal abortionist perform such procedure on you, because they are usually not equipped for any sudden risk that may occur during the procedure. And also remember that it's called criminal abortion because it is illegal in the Federal Republic of Nigeria, with a jail term of 7 to 14 years.
Now, for instrumentation, normally doctors use appropriate instruments, which may be just to suck the pregnancy out. Sometimes D&C done in an appropriate environment with the right expertise may cause abortion and may be sufficient for an abortion and ensure that there is no complication. But when D&Cs are done in secrecy by unqualified persons in a very dirty and infected environment, the instrument itself is infected, and these instruments mimic the true instrument. Some of them use bicycle spokes, because the sharp end, and they believe they can just insert it and begin to fondle with the baby inside the womb. Some have led to perforation of the womb. That is, the instrument passes through the womb, perforates the womb, and goes into the abdominal cavity. I have seen a case of a young girl who had an abortion in Lagos, and the intestines came out through the vagina and freely dangling. But for the grace of God, that lady would have died. Incidentally, she was saved. Now, so perforation is possible with instruments. There is the possibility that infections will be introduced, and in all this, once the pregnancy is tampered with and bleeding begins, because it's done in secret and without any provision for resuscitation, blood and all that, the person may bleed to death. The person continues to bleed, and if help is not coming, or he's not transported or taken to hospital, bleeding leads to shock, and shock leads to death. And this is the unfortunate scenario with criminal abortion.
We would like to especially thank Dr. Shola Akinniyi, gynaecologist, consultant, and fertility expert at TruCare Fertility Clinic. Thank you so much, sir, for the medical information that is extremely useful for so many women out there. Until next time, I remain your wonderful host, Joan Mbanefo Ologe, and it's a wrap on assisted conception on the Health Monitor show. Stay tuned always, and remember to be part of this discussion. Our social media handles and phone number are showing on your screen as we speak. Until next time, remember that health is definitely wealth.